Hello, it's Anna Hause from Hashimoto.Help. I have a great pleasure today to have a special guest, Professor Andrea Evers. Welcome, Andrea.
Welcome.
I would like to say some words about you before we start. Andrea Evers is a professor of health psychology and chair of the Health Medical and Neuropsychology Unit at Leiden University in the Netherlands. After finishing her PhD cum laude, Andrea obtained several personal grants for excellent researchers for her innovative, interdisciplinary, and translational research on psychoneurobiological mechanisms and treatments in health and disease. She has a special interest in psychoneurobiological mechanisms of placebo effects and possible clinical applications. Her research is characterized by a strong interdisciplinary focus connecting social sciences with neuroscience, biomedical, and life sciences. And she has contributed to more than 180 national and international publications and has clinical registrations as clinical psychologist and cognitive behavioral therapist. What a list of achievements. I would like to start our discussion today for a subject that actually brings so much attention the last time, placebo, probably with placing a very clear definition what placebo is.
Yeah, thank you so much, Anna, for inviting me for this special lecture. And I'm very happy to outline and tell a little bit more about the very important issue of the placebo effect. The placebo effect is in itself only an expectation that a specific treatment will work, and without that there is any actual treatment in it. So, for example, you see only a painkiller or you remember your own painkiller and you already feel that you have less pain. For example, when you have headache and you have experience with a very well-known headache painkiller. Or you expect much less pain when you, for example, treat it from a specific doctor or in a specific environment. And the placebo effect is particularly in the area of pain very, very powerful and has, for example, been shown to be as effective as, for example, several painkillers. And that is, of course, very clinical relevant that we see that this important effect on the subjective level exists, but also on a physiological level. A very nice example for a placebo effect is the hidden experiments. It was one of the first experiments where they really clearly showed the evidence for the placebo effect. And these experiments, patients got a painkiller once with in view of the doctor. So the doctor was prescribing the painkiller in the regular way. And in the other condition, the patients did not know that they got a painkiller. So a machine without any information induced the painkilling medication, but there was no information for the patient. And in these conditions, the painkiller had much less effect, or sometimes they had no effect at all. So it was very, very clear that the knowledge of the patient to know that you get a painkiller, to know that you are treated by a well-known doctor in a safe environment, all these contributes to our to the decrease in pain in this situation. And this experiment was very, very important to show one of the first times that it's clearly only the placebo effect which has a really great and large effects on the decrease of pain after the prescription of, for example, painkillers. And now we know already also that it is not only true for pain, but for example, there's a lot of research also in the area of antidepressants and several other areas like Parkinson's disease, immune-related disease, and so on, where we all know that placebo effects play a role. And it is also clear why this is, because a placebo effect is in fact only an expectation that you have about a specific treatment, a positive expectation that in itself can have some subjective and physiological effects on your body. And these expectations, of course, play a role in all conditions and almost all physical symptoms. So they're very, very important. However, we also know about a lot about the contrary, that it's a nocebo effect. There's the nocebo effect is that you have a negative expectation. In this case, the placebo effect is a positive expectation. Here it is a negative expectation about a specific treatment that is not due to the treatment itself. So, for example, you have an idea that you react always hypersensitive to a specific medication, and that only this idea or this attitude can in itself produce a lot of negative side effects or other negative consequences for your body, like feeling more physical complaints or having more physiological reactions due to a medication. And for example, people who are very afraid for side effects have a higher chance of side effects, we know now from research, because the stress and anxiety in itself can produce several physiological reactions. Here again, a very well-known example from several studies that were conducted were that they looked at different studies where they had one condition and where there was a regular intervention, and in the other condition there was only a placebo. So that means that the patients did not get any medication, and they compared the side effects between both conditions. And what they saw, that the number of adverse events, but also the type of adverse events, were the same in both groups. And that can be only explained that patients, for example, read the instruction letter and in this sense have an anticipation of the side effects and then develop side effects. So that is really an impressive example how nocebo effects and have very, very important consequences in the medical environment. Sorry, for example, a very impressive example from recent studies was done in breast cancer patients. The specialist prescribed this chemotherapy, and in one condition, they told these breast cancer patients that they would possibly experience some side effects from their chemotherapy. And in the other conditions, doctor did not say anything about the side effects. And then they followed these women. There were about 200 women. And what they saw in the results was, again, that the women who were told that they would possibly experience some side effect, they reported more side effects from the chemotherapy than the women where the doctor did not say anything about the side effects. Of course, we have to think about then about the ethical consequences of this type of research. So what is the best way then to speak about side effects and to tell something about the possible risks of treatment? And I think we will come to this issue later on here. But first of all, it really makes clear the very important impact placebo and nocebo effects can have on almost every medical conditions and physical complaints. And perhaps the nocebo effects are even more important because these negative treatment effects, of course, are so, have such a high impact for the patient's life. However, when we look overall, we know already that expectations have a very important consequence for also several other conditions. Another very important, for example, for nocebo effects, for example, is the side effects people experience usually also from chemotherapy. When they only get, for example, experience some side effect in the waiting room of the doctor, when they anticipate of, oh yeah, I know I will get the same treatment, and the previous treatment, it was so worse, and have really bad memories about the previous treatment they got. Or another example is that young children with rheumatoid arthritis, juvenile arthritis, usually get a lot of medication for methotrexate, and methotrexate is a relatively aggressive treatment with a lot of side effects like nausea and fatigue and so on. And they usually get this treatment once a week, for example, on Tuesday. And what we frequently see in clinical practice, and that they then already one day before, for example, on Monday, experience severe physiological side effects like nausea and other things, while there is no reason for it, of course, on Monday when they only get their medication on Tuesday. So these are very important examples from how impactful is the research on placebo and nocebo effects. And overall, we know already that these expectations of your ideas about the possible course of your disease or illnesses has a lot of influence, not only, for example, for the future course of symptoms, but also even for mortality of some diseases. But also, for example, very important outcome parameters is adherence, of course. If you have no trust in your treatment, if you're afraid of side effects, there's a high chance of non-adherence and yet to not take any medication. So there's a large range of outcome measures. We know that they are very, very important in the area of placebo and nocebo effects. And I think in every medical research, we should take into account these effects because they are so important.
Yeah, great examples. I think it's important as to the medical professionals, to the patients also, when they can discuss certain things that are not clear or they're worried about with their professionals to make the therapy more working. So it's
Absolutely, yeah. And of course, it is important if you worry a lot about your side effects, for example, you might discuss this with your doctor and look at possibilities of, for example, other treatment, or wait a little bit before you start, or finding a way how it is acceptable for you, because your expectations as a patient have a really great influence on also the treatment outcome on several ways, on your own behavior, on your body, on your mind, so on all what you are in a way. They have an effect, these expectations. And so it is really important to take it serious and also adjust the treatment prescription to these to your own expectations, and ask questions, for example, about your medications. Understand why. Try to understand why why you have made a decision for a specific treatment and so on. Yeah, that's very important.
And this is not just, as we said, between our ears. So it is not just a subjective experience. As far as I know, there are a lot of studies that showing that's how placebo and nocebo works.
Yes.
Would you like to say something about it?
Yes. That is so important that we know now, and that this is not only a subjective experience. It's not only an attitude of an idea, or that I feel a little bit worse or something, but it was really important development that there are specific neurobiological mechanisms that play here a role. The first evidence for this was given by an experiment where they showed that the placebo response to a painkiller could also then again be blocked by another pain antagonist medication. So a medication that has the opposite direction. And this was a really clear evidence that there's a physiological mechanisms that here plays a role, and not only a subjective experience. other evidence that is very important come from imaging studies studying the brain activity. And they really have identified now specific areas that they are involved in, for example, the pain placebo response or a placebo response in Parkinson patients and so on, showing that specific areas, for example, for your emotional well-being are involved, the amygdala, but also dopamine, for example, plays an important role, and dopamine is responsible for rewards or positive reinforcements and others that are, of course, very important in the placebo effect. In the nocebo effect, we know that possibly stress and anxiety might play a role. So, for example, in hormone like cortisol, there are some studies showing relationships with cortisol. So there's specific indicators in the brain activity, but also in other physiological response systems like the immune system, the endocrine system of our hormones, who really are correlated with the placebo and the nocebo responses, and demonstrate very, very clearly that this is not only a subjective response, but that all physiological response systems of our body are involved. So that's perhaps also the reason why this research gets so much attention at this moment, and that this is very popular, and all media report about it. We had a large conference about it, and because of this interdisciplinary collaboration between scientists of all these different areas, we really make big steps at this moment in this area. So yeah, that's quite important, the neurobiological finding. A very nice study is also one in Parkinson patients. They got first the regular medication, but then they got the placebo medication. And what they saw then with the brain imaging, that for example, dopamine they still produced dopamine after only receiving a placebo. That was, for example, also a very, very well-known study. That was, of course, very important because dopamine is very important for Parkinson patients. They have a lack of dopamine. It's one of the mechanisms that play a role here. So if it is possible to condition the medication this way, that even a placebo can produce also these dopamine reactions, and it is also, if it's only a small reactions, it's so clinically relevant, of course, because then the body produces its own physiological reactions. So, yeah, it's very fascinating to see all these different results of the different studies in this area. And I'm very happy that the research is also extending to more and more areas, not only pain, but what I said, Parkinson's disease, depression, anxiety, cardiovascular response system, the immune system, and all other physiological systems and conditions seem to be involved, and there's more and more evidence for it. Yeah, that is, it's really not only important for pain, but I think for all medical conditions and physical symptoms, and also for all physiological response systems seem to be involved.
Yeah, this leads me to a thought that we mentioned expectations playing a role by placebo effect, but in addition to that, we know the conditioning or the learning plays a role by placebo.
Yes.
Would you highlight this?
Yes. Yeah, of course, you ask yourself, why? What is the reason that expectations can be so powerful? It's very fascinating to look at this phenomenon. However, when you understand learning mechanisms, how they play a role, then it's not so difficult to imagine that these expectations can be so important. Learning occurs in several areas. One is conscious way. And this is, for example, that the verbal suggestion from a medical doctor who gives you a little bit instructions, and they say, for example, I expect this treatment might work very well. This is a very clear learning, for example, from parent to children, or in school, or from a medical doctor. And these verbal suggestions can have an immediate effect, for example, on the pain reduction. I will talk about an example for an experiment later on. However, what perhaps much more important is the unconscious processes, automatic processes of our body. And these are particularly determined by other learning processes, namely conditioning. Conditioning we know from Pavlov's dog, this dog produces saliva only after hearing a bell, because the dog expects that he gets some food. So the bell has no meaning at all in the beginning. However, after a while, because of the association between the bell and food, he produces saliva. And that is an automatic reaction. The dog can't think about it. It's really automatically, unconsciously. And this is a very nice example how powerful conditioning can be. When we translate this to humans, we have these same physiological reactions, in fact. For example, we know from a traffic light, we have very automatic reactions to stop when we see a red light, and to go on, we have a green light. Or we have a very automatic reaction when we see, for example, a white coat. There are specific associations everybody has with a white coat from a hospital, and very positive expectations. For example, the doctor makes me better, or for example, you have negative experience in the past. However, these experiences are all conditioned, and they can have strong physiological effects. So when you imagine these conditioning effects, for example, I always say, remember the apple pie from your mother and the taste and smell of these previous memory at home. Usually you have a specific emotional reaction to these specific memories you have. And this emotional reaction is, for example, our conditioning. And this makes clear that conditioning can really play a role for your whole life. A conditioning principle. It's really a permanent something, it's long-term, it's very impactful. And for example, if you have a lot of hospital experience in the past, there are a lot of experiences in this hospital that are conditioned. You have trust with a specific doctor, with a specific hospital, with a specific environment, with a specific procedure or not. Positive or negative expectations, and they all have also physiological reactions, more or less, of course, depending on the conditioning process. So conditioning is a very, very important principle. And to show a little bit an example how we do this in the lab, how we manipulate these learning processes in the lab and how we do our research. There's one example. We do a lot of research in the area of physical symptoms of pain and itch, for example, and we compare also the reactions to pain and itch and the placebo and nocebo effects. And then we induce several short stimulations of pain and itch, for example, with a short electrical shock or cold water or chemical reactions. So different ways we have to induce these symptoms. And then we manipulate the different learning processes of a verbal suggestion or conditioning. And only to give an example, for example, in a verbal suggestion, we say the next pain stimulation you will get will have will be not experienced as a lot of pain. Usually, most people do not experience any pain with this pain stimulation. So we have a direct manipulation of the verbal suggestions here, what we use. Or we say, oh, the next painkiller, most people really experience a lot of pain with this painkiller. And it is very, very nice what you see then that only one suggestion makes such a difference in pain experience, but also in the itch experience. In a way, it makes no difference if you do it for pain or for itch. They are overall the same results. The people who got the suggestion that the painkiller is experienced by others as a very painful painkiller or stimulation, they usually experience much more pain than in comparison to the group who where we said that usually people did not experience a lot of pain. So only one suggestion can make a huge difference. However, when you would like to manipulate this in the long term, you need a conditioning procedure, because conditioning only has an effect in the long term and also has an effect on these bodily changes. So for really long-term changes, you need these conditioning procedures. However, in the short term, the instructions, the information you get, the verbal suggestions you give have a lot of impact. For example, the medical information a doctor gives about the next treatment you will receive. Yeah. So, but in fact, if you understand how learning works, you know a lot about the working mechanisms of placebo and nocebo effects.
Yeah, and if you know that our audience is mainly people who are suffering of autoimmune diseases, so I think it would be nice to hear how the placebo can be used and what we know up till now with application with immune conditioning.
Yes.
By the immune conditioning.
Yeah. Yeah, this is of course so important to look at all possible applications of the placebo effect. And there are some studies who, for example, looked whether specific immune parameters are also involved in placebo reactions. And what I saw in some studies, there are only few studies in this area, first to say. So we have to do a lot of more work. But there is clearly some evidence that specific cytokines, which are an indicator of the inflammation activity, are, for example, in fact, affected by the placebo response. And the best examples have been done in the area of immune conditioning. And immune conditioning means that we directly condition the physiological response of the body. And this has been done in animal studies first. And then they, for example, the animals get some food, and they induced also a severe medication like cyclosporin or other anti-inflammatory medication, and associated this together, gave them this together with the food induction. And what they saw is later, when they gave the same food, with the placebo, the animals also experience the same immunological reactions. After a while, they started to do the same experiments in humans, and they saw overall the same results, which is of course very impressive. What they did then, for example, to give a milkshake 3 days with a specific medication, for example, cyclosporin. There were several experiments in this area with cyclosporin, which is also a medication which is very important for severe immune diseases, and it's frequently prescribed, for example, for multiple sclerosis and others. And they combined this milkshake with a medication for 3 days. After 1 week, they again prescribed the medication, but then they prescribed only a placebo, again with the same milkshake. And what they saw is that the milkshake itself produced the same immunological reactions. For example, on a cytokine like IL-2, which is important for several inflammatory diseases. And this is, of course, very impressive, that after a first conditioning procedure with the medication and an association with a neutral stimulus like a milkshake or something else, the body can in itself produce the same reaction to the milkshake only. Of course, we have to look whether this is useful also in clinical practice. I will come to it later on. At this moment, it is too early to say, oh, can I use this next day in my medical practice and ask my doctor to condition my medication. Of course, we need much more evidence in this area. However, the results at this moment are in any case very promising to look for the future and to do a lot of more research in this area. There have been also, for example, studies looking, for example, at the reaction to allergies. There is some evidence in this area that it might also be promising for allergies, and we are conducting some studies in this area. But for example, also to specific hormones like cortisol, we are looking at this moment whether it is possible to condition cortisol. And there is some very preliminary evidence, and we hope to present the results of these studies in the next 1 or 2 years. And yeah, we hope, of course, there will be much more evidence and much more studies that we can learn much more about this important issue, because the clinical relevance is so high of these studies, of course. Yes.
Very exciting. And I think that this probably might be a moment where it would be interesting to say about the training of the placebo effects that you're doing by Lübeck.
Yeah. Yeah. We and others, of course, are looking for clinical implications because I'm also a clinical psychologist, and for me it is very important to also find some applications in clinical practice, what I'm doing in my research. And I'm very pleased that we have the Leiden University Expert Center here, where we can directly try to translate the findings from the laboratory to clinical practice. So what we do, we are looking for different possibilities how to translate this knowledge to the clinical practice. At first, we look, for example, we do several patient trainings, particularly on the to use these expectations and conditioning principles in the regular treatment of patients. But we also spend some time on the doctor-patient communications. It is, of course, very relevant to look at the possibilities how we can use this to improve the doctor-patient communications, for example, in a relationship that is characterized by trust and by long-term acceptance and warm relationship. It has a much higher chance to produce in the long term positive placebo effects. So it is very relevant to train doctors in this area. The third application is perhaps also for you and your public the most interesting. That is the pharmacological conditioning experiments. And this area, what we do is that we use the medication that people receive in itself as a conditioning principle, and we look whether the prescription of medication could be optimized. There were some studies who showed that it might be much more useful to prescribe, for example, first high doses of medication where the conditioning principles can take place, and after that to lower the doses because you can expect that the conditioning might work. However, conditioning have also an extinction phase, so when it does not work anymore, so then you might use the medication again. So in these new therapeutic studies, they use a conditioning principle of variable dosage of medication, starting with the large doses, then reducing the doses, and then again prescribing a larger doses. So an intermittent treatment schedule, which might be much more effective than only prescribing always the same dosage. Because then conditioning does not work in the long term, because there's no variation in it. You don't make really use of the conditioning effect. And these studies have, for example, been done in psoriasis, that's also immune disease, and chronic skin diseases with inflammatory processes. And they have prescribed specific topical treatments, corticosteroids, and looked whether half of the prescription might be also sufficient when they would prescribe it when they make use of these conditioning principles. And indeed, it was the case in this study, so very impressive. And we are doing these studies now in patients with rheumatoid arthritis, for example, and look whether methotrexate, and what I previously said, and it's a medication which can produce a lot of side effects, can have the same effects when we make use of these conditioning principles. So in the end, we would expect that a lower dosage would be necessary with the same beneficial treatment effects. And we are very happy to do this now in adults with rheumatoid arthritis, but also in children with juvenile arthritis, because they experience usually a lot of side effects from methotrexate. So we are conducting now several studies in this area, and we are looking forward to the results. However, we have to wait for the results at this moment.
And as an online unrated company, I know from research that you don't find any differences between the placebo responses on the expectations given face-to-face and those given online.
We did not use the online treatment specifically in the area for placebo effects. So these are related treatments focusing on the whole package of self-management in chronic diseases. And then it's absolutely true. There's very, very much evidence from meta-analysis from many, many studies, but also from our own studies showing that when you train patients in self-management, they can make use of online treatments, and that they are as effective as face-to-face treatment. And of course, they are much easier to follow because you can follow them from home. You don't have to go to the hospital. You are more flexible in it. So several advantages from online treatment. And we specifically developed several online treatments, e-codes, for chronic somatic conditions, and, for example, applied them to patients with rheumatoid arthritis, psoriasis, and other chronic somatic diseases. And these are very, very hopeful developments in this area. So that is a good thing also about the placebo effect. It is relevant for the patient, and they can train themselves, they can manage the disease in the best way they can, but we can also, or we have also, to train the doctor, to inform the doctors about the importance of the placebo and nocebo effect, to help them to communicate in the best way to patients, and to really work together in a collaborative way with the patients, and to inform, for example, gives the best information about side effects, which does, for example, not mean that you do not give any information, because relationship based on trust is the best basis for a long-term positive outcome of a placebo effect. And this means a transparent and open relationship of a doctor is very important. So you have to tell, of course, the patient about the risk and side effects. But you might, for example, decide that that you give first the information about nocebo effects, and then the patient can make the choice. Would you like to receive more information when you know that the nocebo effect can have a lot of effect, to have more information now about risk and side effects, or that you know a website where we can look, for example, if it's necessary? And I think in this case, most people would say, oh, for me, the website is enough, and I'm very happy to know when it's necessary where we have to look for. But thank you for the information that I got about the nocebo effect. This is so important to know. And at this moment, the regular practice, no doctor at all tells you about the nocebo effect. So we have a long way to go in this way, yes.
Yeah, there are really nice tips for the clinical practice.
Yeah.
If you have tips for patients and something to take home, what would be your advice?
Yeah, there are of course always several tips. There are so many issues that are so relevant. First of course, the knowledge that it plays a role and that is significant. So be aware of your own expectations you have with regard to a specific treatment. If you worry about the treatment, if you worry about side effects, if you're anxious, if you have no trust in your doctor, the best way, for example, is then to talk about it and to ask questions and to discuss it. Usually, I think then you will make the best decision and this is fine. However, it could be the case that you still have some worries and don't feel comfortable. And then, of course, you can make the decision not to start the specific treatment at this moment, but to start, for example, later. In any case, every decision is fine, but take it together with your doctor, discuss it, and be aware about your own attitude. And for example, and also for adherence, this is so important. If you have a positive expectation, then go for it. Take some medication and go for it 100%. It makes absolutely no sense to wondering whether it may or not work and to take only 50% of the medication because then nobody knows whether it might work. So if you have trust in a specific treatment, it's great. If you don't have trust, you can discuss it, but you can also wait or make other decisions. That is, I think, the most important message for the patients. And then, of course, also, remember that it has specific physiological and neurobiological reactions. Of course, it differs between individual patients. It could be for you different than for your neighbor because people differ always also in the physiological reactions, but overall recognize that it is important. And also tell the doctor, perhaps tell your own doctor about the importance of this research and that you think that it is very important to spend some time on communication and all these aspects. So I think it might be also a very nice and wonderful consequence if all patients would discuss this with their own doctors, because we all have are important in this and bringing this research and the clinical application a step forward.
I think it's an empowering message. Thank you, Andrea.
Thank you. Yeah, thank you so much for this invitation.
Thank you for joining us and sharing the knowledge.